present over here. I once again, on behalf of my entire department, extend a very, very warm and cordial welcome to each one of you. So you have been having your foundation day for the last few days. This is the third day, I suppose, or second, fourth day, okay. So why do you have this foundation day? Anyone? It's basically to get to know each other better, okay? To know your batchmates, your teachers, the departments, all the facilities, all the infrastructure. And today we are here so that you get to know the Department of Anatomy, okay? And along with it, a very important part of the Department of Anatomy is the cadaver. So we would be also having a cadaveric oath, and we'll be telling you the importance of the cadaver and how to maintain the utmost respect for the cadaver. So we have, before going to it, I have had a brief introduction with you all, and I did lay emphasis about the subject. I did tell you about anatomy being the science that deals with the normal structure and the development. I also told you how anatomy has been given more number of topics, more number of competencies compared to other subjects. The idea was not to belittle any subject. All subjects are very important. The idea was more to put emphasis on the point that why anatomy is called the core of the entire medical curriculum. So why should you believe me when I say that yes, it's the soul of the medical curriculum? Supposing, for example, like anything you can take, like a doctor who has become a gynecologist or a cardiologist, okay? And supposing you are a cardiologist and you have to operate on a heart, you have to do an open heart surgery. You need to know where the heart is. You have a general idea, of course, that the heart lies in the thoracic cage, okay? But with that general idea, would you be opening the thorax to go into it? So how do we teach you in first year about cardiology? No, we don't. We just tell you about the normal structures, and those knowledge will help you later to use it, whether you are into medicine or into surgery. Going further into this example that I was telling you, supposing you have to do open heart surgery on a patient, and you have certain knowledge that you have learnt in anatomy and also in physiology about the cardiac cycle, and in pharma about the drugs. So while teaching anatomy, there is a part of anatomy which is called surface anatomy, okay? So there we tell you, okay, there is a bone over here which is called as the sternum, the breastbone or the sternum. So when you move your finger down the sternum, there is a, just do that, there is a ridge over here. This elevation is called as the sternal angle. Okay, we tell you about it, the angle of Lewis. So what about it? We tell you that over here you have the ribs attached, and the rib that is attached to it is the second rib on either side. Okay? And this is the uppermost part of the heart. So now you know where the heart starts from. Okay? You go to the sternal angle, you go to the second rib, and you know the heart, the upper border of the heart would be lying somewhere at the second rib. Similarly, on the back, if you have to approach the heart from the back, we ask you go to the vertebra, the vertebral column, you see the spines of the vertebra. You know what is cervical? Cervical means the neck. So you have the cervical vertebra over here. So when you move your fingers down the spine, you find a very, very prominent spine, that is the seventh spine. Seventh cervical spine, okay? You go two spine downwards, the T1 and the T2 spine, and that is the upper border of the heart posteriorly. So you know posteriorly the upper border of the heart would be somewhere over here. With those knowledge, those kind of knowledge, you would be opening the heart of a patient. Okay? And what if you don't have these knowledge? You can blunder, and your blunder could actually, your knowledge could actually save a person's life, or that lack of knowledge could actually lead to a loss of someone's life. So you know the importance of knowing anatomy. And that is why NMC has given, Madam, could you just put, Dr. Aditi, the number of hours that has been given to anatomy is far more than any other subject of the entire 22 subjects that we have. Even the competencies, I think medicine has slightly more, otherwise all the 22 subjects has below it. Okay, so I'll show you some other day. Okay, I'll show you some other day. So when you have a subject as important as this, as vast as this, and another reason why I feel it necessary that I tell you that anatomy, of course, is one of the 3 subjects, but when you are dividing your time into 3 subjects, you can't say that, okay, 1/3 should be physiology, 1/3 should be biochemistry, and 1/3 should be anatomy. You should ensure that अगर आप समझिए आप एक क्रिकेट मैच खेल रहे हैं, आपको 30 ओवर में 300 रन बनाना है, तो आप ये तो नहीं कहेंगे कि मैं 10 ओवर में 50 रन बनाऊंगा, अगले 10 में 50 बनाऊंगा और अगले 10 में 200 रन बनाऊंगा. So you need to divide your time accordingly to anatomy, physiology and biochemistry. Well, that's just an advice. You are entirely entitled to do it your way, but the importance of anatomy should be understood and appreciated, and with that background you should prepare for other subjects also. Coming to, we'll be having an introduction of the department of all the faculty member and the cadaveric oath. But there are few things that I'm very particular about. In fact, I'm speaking it in behalf of the entire department, that there are few things that we expect you to do it. And if I put it in a very, very simple way, I would put it as A, B, C, D, E. So starting with the A is your attitude. And your attitude doesn't just mean that your behavior, your humility, it defines you in every which way. The way you are dressed up, the way you are behaving. हम कहते हैं कि अगर आपको सरस्वती को पाना है तो आप सर उठाकर नहीं, आप सर झुकाकर ही पा सकते हैं. सरस्वती is the god of knowledge, you all know. तो आप जब भी कुछ हो तो आप बिल्कुल ही your humility should be there at all time. The way you dress up, the way you talk. Okay? And these are nothing that you don't know. You all come from a very good family with a very good upbringing, and these have been taught to your parents. But sometimes when you forget, we need to remind you that. And I'm not trying to scare you or anything. I'm just telling you. So your attitude should be very, very humble. The way you dress up, we are very particular about how we are coming. Okay, we don't want you to be with boys with big hair and like with a button open with the collars rolled up. No, that is not something that we would want you to be. Be very proper. Try to be formal. Try to wear a formal shoes. Okay, I can leave that for a Saturday for a weekend dressing, but normally speaking, be very decent in your dressing up. Your hair should be neat, clean, tight. Second, your behavior in the class. It's very important that I tell you today that a lot of students, they are not interested in the class. Well, that's entirely up to them. Not being interested is one thing, but to be in the class, not listening is still okay. But to disturb the class in any way is just not permitted. And you should remember there are many cameras all around. There are many people sitting all around the faculty also, the PG students. So please be very proper in your theory classes. Okay? I don't say don't talk in the class. You can talk while the teacher is facing you, but try to be very proper. The last thing I want is when the teacher is turning up his or her back towards you, then you should be talking. So don't talk. Your behavior in the class is very, very important. And in anatomy department, we are very particular that you be very proper in your behavior. Is it okay to expect that? I'm not asking for too much. Okay? Second is your commitment. See, well, there are two ways of it. सर ने कहा था वीसी सर ने कि जो चीटियां चलती हैं मुझे पसंद नहीं है. I totally agree to it कि एक लाइन से एक कतार से आ रही हैं. Okay? So नहीं, if you are here, be with a purpose, be with a commitment that I want to learn something and go. Okay, your commitment would define your future course. Fine. Your D is, of course, discipline, and we are very particular about the discipline, particularly the discipline in the DH, and Colonel Shekhawat would be talking in length about it. When you have to come in the DH, from the class, you have to go to the DH. You can't go to the canteen, you can't move around, you can't stroll. You just have to go to the DH and be there by 11. The class is set free from here. By 11:10 you should be there. अगर क्लास को किसी वजह से देर से छोड़ा गया है, we will allow you that extra 5 minutes or 10 minutes. But if half the student or 50 students is inside the DH, that means the class has been left on time, but you are late. So we have very strict rules for that. We don't appreciate people coming late. Once you are in the DH, you can't just leave the DH and go out without permission of your batch teacher and the DH in charge, Colonel Shekhawat again, okay? So all these discipline has to be taken in mind while you are doing your theory or your practical classes. And finally, E is, of course, the ethics. Ethics would mean honesty. Your honesty is paramount. I think if you are not honest towards yourself, towards your parents, towards your teachers, I think the lesser said, you can't achieve anything. You have to be honest towards your profession, okay? And having said all that, we tell you our mode of teaching in this department, our mode of teaching is very, very interactive, very, very friendly. I want my teachers to interact with you, to let you express. I don't want you all to be sitting like a wall and listening. It should not be a one-way interaction. We have a very youthful and young faculty member sitting, and they are all very, very eager to interact with you. And we want a two-way communication. We want you to enjoy. Just remember the A, B, C, D, E. I don't want you to be scared of us. I don't want to be there to be a wall between you and the teachers. Just let there be a line. Let there be a line. Don't cross that line. There shouldn't be a wall between a teacher and a student. We are there you can access us at any time. We have any problem, we are there. We are like an extended family. Okay? So you don't have to be scared of us. You don't have to be intimidated of us. You just have to be proper. With all that, I once again wish you all the best. Let's have a very, very nice academic journey together with you all. I would like to now request Dr. Abhilasha to take over the stage. Okay, this was the hours. Just to give you a idea of how much hours has been devoted to anatomy. Again, physiology is very important, biochemistry is very important. I quite, in a lighter note, I say that anatomy department is in the first floor, and physiology is above and biochemistry is below. So anatomy is sandwiched between the physiology and biochemistry. So you know what is the main part of the sandwich, the filling. So we are the filling of the sandwich, but we can't make a sandwich without the bread. So the bread is also very, very important. So I think you all have seen the
respected HOD, Dr. Pankaj Singh sir, fellow colleagues and dear students, a very good morning to you all. So, I feel privileged to welcome you all to the Department of Anatomy. Sir has welcomed though, but we all, as colleagues, as faculty, we all are happy that we have a new 2024 class, and we want that you people to set new rules, you people to like you will lead the things, and we all are like prepared to, we have planned to teach you all, but the dedication and the things should come from your side also. Yes, I want to do something in life, and I tell you, while we do the things, the journey is quite important. At that day also I said ki don't think about the results, don't think about where you have to reach. The way you do the things every day, that means a lot that means a lot in your life, that means a lot to us. So spend each and every moment of yours in a way that yes, I am giving my best. So that means you have to do planning, you have to do the things. Coming to the anatomy part, basically what anatomy is in this department, you will become familiar with the structures of the human body, you will become familiar with the very minute details of the human body. And I would say, if you learn, if you read, if you do dissection, if you go to the histology part, you will become involved with the human body, and that is very important for becoming a doctor, I think. So, but when you will become involved, when you give your best, when you will work hard, when you do the things in a right way. So, in the Department of Anatomy, basically to teach you anatomy, we have a dissection hall, we have a histology lab, we have museum. Dr. Abhilasha will tell you in detail about the things. But again, I would say the more you do, the more you will learn. So, regarding the departmental things or the way you will be learning in this 1 year, I think you are familiar that you will have a 1 year course. In this 1 year, for this 1 year course, we have planned each and every moment for your learning. We will be planning in a very meticulous way how you people will be learning, but you should make a habit to see the timetables, in advance. We will be placing the schedules there. You have to go and see. Do you know when your classes will be starting? Like academic classes will be from which date? They are from 17. Some are saying 16 and some are saying 17. So probably they are from 17. We will put a schedule there. एंड आपको एक हफ्ते के बाद में क्या करना है, आप क्या करने वाले हैं, उसकी प्लानिंग आपकी आज से शुरू हो जानी चाहिए. या ये पूरा सब्जेक्ट कौन कौन से रीजन्स में डिवाइडेड है, मुझे इस पूरे साल में क्या क्या. नाउ यू पीपल आर अडल्ट्स, डू यू अग्री विद दिस? तो हम वो जो स्कूल वाले पार्ट से अब थोड़ा बाहर निकल आए. यू हैव टू प्लान द वे यू आर गोइंग टू स्टडी. सो फॉर दिस 1 year यू शुड ऑल्सो हैव अ प्लान. वी विल टेक योर फीडबैक ऑल्सो कि मुझे इस महीने में इतना पढ़ना था और मुझे जितना सीखना था क्या मैं उतना सीख पाया हूँ, या अगर हमारे साइड से कुछ होगा तो then you people can come to us. We will be talking to you. Sir has already said कि हम फीडबैक आप लोगों से लेते रहेंगे. हमने एक प्लानिंग करी है आपको पढ़ाने के लिए, लेकिन आप इस एक महीने में क्या सीखना चाहते हैं. I want you to write your own learning objectives for that particular month कि आप अभी से देख लीजिए. आप जो फर्स्ट जो आपका क्लास है, that is introduction to anatomy. There we will be telling you कि in which regions the body is divided. We will be teaching you those regions. But वो region को अगर हमने एक month दिया है तो मुझे उसमें कितना करना है, कब मेरे assessments होने हैं. ये जो orientation program है, ये जो foundation course है, don't think कि इट्स जस्ट अ वेस्ट कि ठीक है हम आ गए हैं और हमें बस आके हम रोज मोटिवेट कर रहे हैं पर हमें कुछ नहीं करना है. तुमको अभी तक जो 2 दिन जो लेक्चर्स हो चुके हैं, यू शुड स्टार्ट फॉलोइंग दोज थिंग्स. कि ठीक है अब हमें प्लान करना है. योर ओनर्स ऑफ लर्निंग लाइज ऑन यू at the most. We are there to facilitate you, we are there to help you, we are there to give our 100% to help you out, but we will not be able to help if you people don't come to us, you people don't talk, you people don't share your things with us. We are there, but you have to take the initiative. That is what I want to convey. And a second thing is, sir has already told you, the first and the foremost thing which we want in our department is the discipline. Without discipline, without following the rules, learning cannot happen. So if you want to learn, if you want us to do the things in a newer way, we want you have to be disciplined. And the second thing is, try to inculcate the habit of सेल्फ डिसिप्लिन. हमें दिखाने के लिए वहां थोड़े घंटे ऐसा डिसिप्लिन मेंटेन करना हम भी नहीं चाह रहे हैं, तुम पे कोई चीज इम्पोज करना. तुम एक सेल्फ डिसिप्लिन अपने अंदर लेके आओ कि हाँ ठीक है, अगर कल मुझे फ्रंट बेंच पे बैठना है तो मेरा फ्रेंड कुछ भी कहे, मुझे अगर टाइम पे पहुंचना है तो चीजें कुछ भी हो, मैं आधा घंटा पहले घर से निकलूंगा, मुझे आगे जाके बैठना है, मुझे 4 लोग बोलेंगे कि तुम पीछे चलते हैं, हम ये करते. बट इफ यू हैव डिसाइडेड समथिंग फॉर योर बेनिफिट, देन यू मस्ट inculcate this habit कि okay, I will stick to this habit, I will sit at the front bench. हम चाहते हैं कि तुम्हारी लड़ाई हो कि हम एक रोटेशन लगाएं कि तो हम आगे आना चाहते हैं. डोंट गो एट द बैक. जहाँ बिल्कुल फर्स्ट एंड द फॉरमोस्ट थिंग हम बिल्कुल इम्प्लिसिटली बता रहे हैं. इन्वॉल्वमेंट कब होता है? व्हेन देयर इज आई टू आई कॉन्टैक्ट. जब मैं तुम्हें देख रही हूँ, तुम मुझसे बात कर रहे हो, तो तुम्हारे साइड से भी उतना एफर्ट होना चाहिए. मेरी आंखें तुम्हें ढूंढ रही हैं, लेकिन तुमको भी उतना एफर्ट करना है कि मुझे आगे आके बैठना है, मुझे बात करनी है, मुझे लर्न करना है. तुम अपने लर्निंग ऑब्जेक्टिव्स खुद डिसाइड कर सकते हो. इन दिस वे यू कैन लर्न बेटर. And one more thing which is very important in the journey of anatomy department कहते हैं मेडिकल स्कूल में एक तो डिसिप्लिन बनाता है, रिस्पॉन्सिबल बनाता है सबसे ज्यादा स्टूडेंट्स को. अभी तक यू वर स्कूल स्टूडेंट्स, यू आर कंफ्यूज कि हाँ मुझे एक लाइन मिलेगी, मैं यहाँ जाऊंगा. अब वो लाइन तुमको मिल गई है, तुमको अब कहाँ काम करना है, तुम्हें यही काम करना है. लेकिन यहाँ काम कैसे होगा? when you will learn to bear the responsibility. So you have to bear the responsibility of yourself. बस अपना कर लो, बाकी सारी चीजें अपने आप सेट हो जाएंगी. सिर्फ अपने को खुद को बैलेंस कर लोगे, तुम देखोगे कि यू विल बी एबल टू हेल्प अदर्स ऑल्सो. पर पहले खुद डिसिप्लिन हो जाओ, उतना करो. रिस्पॉन्सिबिलिटी तुमको यहाँ हमारे एनाटॉमी डिपार्टमेंट से रहेगी, मिलेगा एक्चुअली. जब तुम पढ़ोगे, जब तुम करोगे, तो यू विल लर्न कि हाउ टू बिकम रिस्पॉन्सिबल. सो नॉट टेकिंग मच टाइम, और ऐसा स्पीच वाले इसमें मैं नहीं जाती हूँ. I again congratulate you all, and we feel very happy that we have a new class 2024 to which we will teach with great enthusiasm, and we want the same enthusiasm from your side also. So congratulations and best wishes to you all. Thank you so much.
Thank you, Prabjot ma'am, for those much needed points to be followed by the students. Now let's carry forward the introduction to the Department of Anatomy. To start with this, I have one quote to share. The quote is by Albert Einstein. I quote, "There are only 2 ways to live your life. One as though nothing is miracle. The other is as though everything is miracle." And I assure you that while you start studying anatomy, you are going to realize that your life is a miracle. And you are going to ponder upon that who is the scientist behind this marvelous creation. So let's start with this. Our department is committed in developing a 360-degree round development of student, instilling in them the skills, the knowledge, the commitment, the confidence, We have very dedicated, experienced set of doctors and professors, and our department, as you have seen, our HOD and professor sharing their guidelines. So we have a very well supported, student friendly environment. And most important thing, which is a unique point of our department, the Mahatma Gandhi Medical College is the first private medical college to have 3D anatomy virtual table, which is Anatomish, and it is second most in Rajasthan after AIIMS Jodhpur to have this technology in our department. So you must feel lucky enough that you have chosen this college your as your choice. Now let's start with it. When it started, the department was established in the year 2001. Initial, there were a strength of 100 students, which increased to 150 in the year 2008, and then it increased to 250. Like I think you are probably 250. You're going to be 250. So it started. We got the permission in the year 21. Facilities in our department, the place where you are going to perform dissection, where you are going to study osteology, surface marking, radiology, and where you are going to make new friends, which will be there with you till the internship. Those are all the things will be done in the practical lab known as dissection hall. This is there on the ground floor of the main college building. We have original set of bones. We have 22 cadavers, and every student will get a chance to perform hands-on on the cadaver. Then we have histology lab, a separate lab to study microanatomy. We have enough binocular microscopes to study microanatomy. Then museums, we have different specimens of different parts placed on in the museum room, and also we have different models of the embryology placed in the museum room. Then we have seminar and departmental library. This place is mostly utilized by the postgraduate student for presenting their seminars. So this is the thing. This is the most important part of our department. This is the highlight, and which will going to make you feel lucky. I assure you, before any dissection to be carried out in the department, the parts and the sections will be shown here on the 3D virtual table. Then we have ICT enabled tools. We have well equipped lecture theaters in our department and demonstration rooms. As I said, we have a very student friendly environment, and our faculties opt for different types of teaching learning methods. We have small group discussions. Then we have DOAP, which stands for demonstrate, observe, assist, and perform. All these are student centric methods. So lecture should be, two ways. It should not be like teachers has delivered and you have listened to it. You should be part of the lecture also. Then peer learning and seminar. Seminar topic will be given to you, a group of 5 students. One has to make PPT and then another has to share it. So these all are done in our department. Now, from the last year, undergraduate combined round has been started by our college. So you people will not be only limited to the Department of Anatomy or Physiology or Biochemistry. Every month you will be given a chance to participate and present your side of anatomy, physiology or biochemistry of the given case. Okay, so if you think you are capable enough, you should give your names, come out, participate in such interdisciplinary approaches, which is being conducted by our medical college. And I tell you, this is also chairman by our emeritus chairperson, Dr. Swankar sir. Here is the strength of our department, 24 faculty members. You go and find out in all the colleges of Rajasthan if you get this much of strength of teachers in the medical college. So let us go through who are your teachers in the anatomy. I don't think sir need any introduction. We have already had an interaction today and day before yesterday. So Dr. Pankaj Kumar Singh, our head of department, once you attend his lecture, you are going to be his fan for lifetime. You're going to be his follower. I've seen students from the intern, those are still coming to the sir and wishing him and always taking his blessings. Then we have eminent professor, Dr. Prabjot Kaur, who has been interacting with you in the MEU sessions in the foundation course. Again, we have eminent associate professors, Dr. Nahid Yasmin, Dr. Meenakshi, Dr. Rati Tandon, and Dr. Manali Arora. And then we have assistant professors, Dr. Colonel Sunil Singh Shekhawat, Dr. Sakshi, Dr. Runjhun, Dr. Puneet, and myself. Then group of young faculty members who are gonna there to support you in your practical labs in the dissection hall, then in the histology lab. We have Dr. Rishika, Dr. Ashima, Dr. Renuka, Dr. Pramila, and Dr. Ritu B as demonstrators. They are again JAs in the department also, again young faculty members. Dr. Manju, Dr. Mohammad Afroz, Dr. Ravi, Dr. Kushal, Dr. Bhavika, then Dr. Hemlata, Dr. Vikas, Dr. Pavan, and Dr. Anil. Then we have three PGs, the postgraduate student who are going to guide you, just seniors to you, gonna be with you in all the procedures done in the department, Dr. Aditi, Dr. Arpit, and Dr. Prerna. But as Shah Rukh Khan says, picture abhi baki hai mere dost. There's so much things that I have told you in the section hall, histology. It cannot be, it cannot run without the support of our non-teaching staff. We have Mr. Buddhi Prakash, Mr. Satish, Mr. Dinesh, Mr. Mukesh. Mr. Buddhi Prakash, all these four, they are there since the starting of the college. Mr. Buddhi Prakash ji, they take care of all the computer work. Then we have Satish, Mukesh, and Dinesh ji, who take care of the embalming and the practical labs. And we have Mr. Ram Charan ji, who is great modeler, and he is making all the embryology models for you people. And then we have Mr. Rakesh. He helps us to conduct lecture properly because he sets all the instruments and put the mic on for all of us. Then we have our uniqueness. See, besides innovative technology, we at the anatomy department also conduct cadaveric workshop in collaboration with different department of the hospital like ENT surgery and orthopedics. And there are hands-on procedures which are performed by the postgraduate student and MCH. So achievements of the department. Our head of department, Dr. Pankaj Kumar Singh, recently felicitated by a social group of the Jain Samaj at the national level body donation and organ donation program. Again, on Independence Day, he was awarded as for the work of excellence by our chairperson, Dr. Vikas Vankar. These are some of the headlines of the highlights of the cadaveric workshop being conducted in our department. Since last few years, our department is religiously following and conducting white coat ceremony and cadaveric oaths. So today is the D-Day for those two ceremonies. And again, we are incomplete without our talented students. Last year, we carried out body painting and Rangoli competition, and with students actually not only participated, they have shown their talent, how much talented, enthusiastic they were at the time, that the results were excellent. And this program was also attended by Principal Sir and Pro VC Sir. So here are some of the highlights of the same program. Excellent body painting done by the students of the batch 2023. This is not easy. You are smiling watching this, but this is not easy. Then the histology Rangoli competition. And then, yes, much needed appreciation for the students. And as our VC sir said, all the work and no play makes the Jack a dull boy. So we all request you that also find your one passion and follow it other than the studies. Here are some of our students who participate in the basketball, in the chess league, and this is the photograph of our student of 23 batch receiving the trophy from the Diya Kumari ma'am. And again, talented students hain to talented teachers bhi honge, of course. So we have extraordinary students guided by the extraordinary teachers. Some of our teachers were felicitated at the time of different occasions. Best practices of our department. So besides innovative technology and cadaveric workshop, there is one thing that is followed in our department. At the time of body donation, there is tree plantation program is undertaken, where the family of deceased also participate, and this is in the honor of and in the fond memory of the deceased who has given his body for you people. कहते हैं ना, Department of Anatomy equals to where the dead teaches the living. So this is all by our department, and lastly, let me share a photograph of all of us together. This is us, and we are sending good vibes and blessings. Thank you.
So around 22 cadavers we have, and these cadavers, they are well preserved. Well preserved means they are preserved by one important process that is known as embalming. Okay. So the important thing that is, we must give, or everyone must give the respect to the cadaver as your first teacher. Remember always, cadaver is your first teacher. So maintain the dignity of cadaver in dissection hall. Cover the cadaver whenever you have completed your dissection to prevent the drying effect after the once you completed your dissection. Now, what is dissection? What is the definition of dissection? Dissection is equivalent to the Latin word that is anatome, to cut up, or dissection means to cut a part of body, then separate it, then clean and see the structures. This is dissection. Okay. How do we embalm this cadaver? It is a treatment by the special chemicals like formalin, so as to protect it from putrefaction or the decay. So why do embalm this cadaver? Why it is necessary? For thorough and complete preservation of that body, and there will be no risk of fear of contamination or infection to the student. Then prevention of putrefaction and changes in the body that cadaver. Then prevent of contamination with the insects and maggots. Then reduction of potential hazards. So sitting arrangement, you will be 250 students, and you will be divided in 4 batches, A, B, C and D, and you will be seated in around 63 students will be in the one group. You can see these pictures. Now coming to the things must to have in dissection hall, means safety measures. First is apron. Apron is why it is required? To protect your clothing. Okay. Then shoe. You should wear your shoes because it gives safety to the foot from the dropped scalpel or the sharp instrument. Then gloves. Use gloves to avoid the contact from the preservative and the chemicals. But the important thing, whenever you touch the structures, the naked hand are best. Specs and goggles. Whenever while cutting the bones, use specs or goggles to protect the eyes and against the foreign body during the cutting. For better handling of cadaver, every student should follow these rules. First, for the girls, all the girls are hereby informed that plaited or braided hair, they should be inside the apron. See these 2 pictures. First is this is right and this is wrong. Now, in dissection hall, while dissecting, your expression should not be like this. Your first reaction to formalin preserved body should not be like this. I know the formalin, it is slightly irritant chemical. After some time, you will be habitual of this. Safety procedures for the students. Follow all instructions given by your teachers in the dissection hall. First thing. Then inform any illness as a result of exposure to the chemicals. Avoid any contact with the preservative chemicals like formalin. Prevent splashing of any chemical into the eye. This is most important. mandatory for you all to wear gloves while performing the dissection. See, this is the one student is doing dissection and he is wearing the gloves. Then handle scalpel or blades with the extreme care. Always cut away from you and away from the others also. So this is the right technique and this is wrong technique. Properly dispose of your gloves. Store specimens as directed by the teachers. Clean up the work area and return all equipments to the proper place when the dissection is over. Okay. And wash hand with the soap and water after each dissection. So you all have to learn to pay respect to the cadaver lying there to teach you how to treat the living. I am again emphasizing on this slide. Why? Because cadaver is your first teacher. You should maintain the dignity of cadaver. Handling of body parts and infectious material in the dissection hall. How to handle these tissue which you have already cut from the cadaver. So we can segregate the waste in the like this. We have black bucket. You can put the general waste or the non-infectious waste in that black bucket. Then red bucket, infectious plastic waste like saline bottles, syringes, catheters, and the most important yellow bucket, the anatomical tissue or the soil waste. Whenever you put your anatomical parts of the cadaver, you should put in the yellow bucket. Okay. Then white puncture-proof container. You can put the metal and the glass sharp waste like broken vials and the needles in the white puncture-proof container. Now you can see these pictures. Important thing. The gloves you can put in this red bucket. Okay. And the syringe without needle. Okay. Then saline bottle. Then in the dissection hall we use this scalpel blades, and the scalpel you can put in this white container. Okay. Then again this yellow bucket. All the specimens, all the tissue which you have already cut, they should be put in this yellow bucket. Now the most important slide about the dissection hall. This is the most important slide. The disciplinary rules and regulations in the dissection hall. Remember it, no student will be allowed in the dissection hall after 1110 hours. Okay? Without formal dress, without apron, without dissection kit, without gloves. Remember it. Then don't leave your dissection table during dissection time. Most of time, some of your students, they go roam around in the dissection hall. Stable, say stable, stable, say stable. So you should not do that. Then again, very important for the cadaver, no pics allowed to be taken of cadaver. Remember it, no pics to be taken allowed of the cadaver in the dissection hall. And जो आजकल आप लोगों की एक हैबिट बन चुकी है, everything should be go on the Insta or the Facebook, on the social media. So cadaver pics never to be uploaded on social media. Okay. Then don't leave dissection hall without information to your table teachers and permission of dissection hall in charge. Okay. Then I will stop with this message. A compassionate heart, a creative mind, and skilled hands are as important as academic and clinical skills for a physician to handle life with care and dignity. Thank you.